Very good afternoon, everyone. It's Dr. Bong from Essence Medical Cosmetic Clinic, and I have Kieren, who is a very well-known blogger in Scotland and internationally. And Kieren today is going to have some Botox for wrinkle reductions, but there are a couple of things we are going to do for Kieren. But before we proceed to having the procedure, I think Kieren has 3 questions to go through with me, and these questions are commonly asked, not just Kieren, that she gets these 3 questions. I get these questions on a day-to-day basis as well. So let's start.
So, firstly, are the effects immediate? That's the question I'm asked all the time. Can you see a difference straight away?
That's a very good question. Pharmacologically, Botox takes about 3 to 5 days to kick in. So pharmacologically, it is not possible to see immediate results. However, in practice, it is not uncommon that our patients notice an immediate result. And that's to do with the fact that the moment the needle goes through the muscle, it causes a degree of trauma. And when the muscle senses that there is a degree of trauma, it goes into spasm. And that reduces the muscular contracture. So whilst you see an immediate result, but it is not as a result of the pharmacology of Botox. It's as a result of the muscle responding to the pain and the trauma secondary to the procedure itself.
Okay, that's great, thank you. Another question, and one, I've had experience of this. Would you recommend that people had Botox, for example, at a beauty show and places like that?
Yes, if we take a couple of steps back and we think about what is Botox, and Botox is botulinum toxin, and it is a prescription-only medication. And it being a prescription-only medication, it has to be prescribed by a medical professional. And it being a prescription-only medication, we are also legally obliged to not promote it. And it being a prescription-only medication, it is also required that it is performed, the procedure of injecting Botox for wrinkle reduction is performed in an environment that has been designed for a medical procedure. And then we look at the qualification of the person who is injecting it. At those beauty shows, number one, it is frowned upon, it's a very bad practice to promote a prescription-only medication. In fact, some might argue that it is illegal to do that at a beauty show. And also then you look at the environment where it is being carried out. It is not an environment that's hygienic, that's not sterile. So from a medical procedure point of view, and wrinkle reduction with Botox is a medical procedure, it is not the right environment to have the procedure. Then you talk about the lighting and the height of the chair. Here in a proper clinic, we have a hydraulic chair. We can adjust the height according to the height of the patient, and we have proper lighting designed to highlight the anatomy, and we have an environment where we have access to emergency equipment. So although when you look at videos of the procedure being carried out, it seems very straightforward, but it is a medical procedure. If it's not done properly, there is no proper analysis of the anatomy, and if it's not done properly, it can come with disastrous complications. So it is not to be taken lightly. And so my conclusion for that question is no. It is a prescription medication, so it's not to be performed in an environment that's not designed for it.
I can concur from my experiences. And finally, how is Botox used for a brow lift?
Again, that is a request we get on a day-to-day basis, isn't it? What a lot of patients do not understand is it's all about creating muscular imbalance. The practice of cosmetic medicine, and specifically the use of Botox, is not an exact science. So it's not like the little dimmer switch you have in your bedroom that you can tune precisely the intensity of light that comes off the light bulb. So it's not an exact science. But to summarize how it works is, if you imagine the game tug of war, you and I, we are pulling against each other. So if I want to win, the only way for me to win is to make you weaker. And then when you are weaker than me, I will pull you over to my side. So if you imagine this is you, and you pull the eyebrows up, and this is me, I pull the eyebrows down. So if I want to achieve a brow lift effect, I want to knock out and weaken this particular muscle, which is responsible for pulling the eyebrows down, and I want to preserve the strength of the muscle in the forehead, and by doing that, you will then win the game, and then you will then subsequently pull the eyebrows up. But conversely, we've also seen newsreaders or celebrities with eyebrows which are what we call hooded. And that's as a result of the fact that they knock out the strength of the forehead too much. The muscle here is responsible for pulling the eyebrows up, and then they preserve too high a strength of the one that's pulling it down. So when you create a muscular imbalance that way, the one that's stronger will win, and it will pull the eyebrows down, and it causes one of the complications that's not uncommon, called hoodedness of the eyebrow. So it's not an exact science, but you can increase the percentage of the success rate by going to somebody who is experienced, who understands the anatomy, and who understands the dynamic of creating muscular imbalance. But accuracy and precision is very, very important. With the understanding of the anatomy, you can increase the percentage of the success rate, and that's how we normally do it.
Excellent.
Excellent.
I'm ready.
I think those are three very important and very interesting questions, and we get that all the time. So hopefully you have an insight about how things are done, and if you have any other questions, you can email Kieren,
Yeah.
or you can email
Leave a
myself.
comment.
Great. So we'll do the procedure now.
Thank you.
Excellent.